Welcome back to New Money. This evening we're discussing healthcare, and my guest is Kevin Aaron. He's Principal Officer of MedShield Medical Scheme. And if you'd like to email me, if you've got any questions, you can still email me on info@anchor.capital.co.za. Kevin, let's just go back, because I'm a bit concerned where we're going to. You made the comment that people, and this is the time of the year, and I also said at the beginning, I've brought this program forward because to give people time to assess where they are. We're only at the 20th of November. People wake up come January, into December, it's a bit late. So just talk about three things. One is cross-subsidisation. Where's that going to go? Because it appears that this could be a problem. I'd like you to comment about NHI, and I'd like you to comment on what's been happening. You're hearing about all these wonder drugs, and so many people are saying the medical aid should be providing me the wonder drug to live.
Bryan, thank you. So I think, what was the first one?
Cross-subsidisation.
Yeah, so where is it going? I think that medical schemes have to become more innovative in terms of how they're going to attract younger and healthier people into the schemes. And I think technology can be one of those routes. A lot of players in the market are looking at plans now which are driven around technology, where you can you can go in via a virtual platform and, for example, see a nurse or a doctor on a virtual consultation at a much cheaper price. There's initiatives like Hospital at Home, where instead of lying in a hospital for maybe 2 or 3 weeks at a time, based on your condition, you can actually be at home, and you get nurses that come and see you on a daily basis, and if required, then there's a doctor that's available. We've got to look very, very carefully at the amount of fraud, waste and abuse that's happening in the industry, and intensify our efforts to weed out fraud, because there's no doubt, and it's worldwide, there is a significant amount of fraud that goes on with regards to the medical aid industry. So we've got to become more innovative. We've got to find ways to find options that are cheaper and can attract young and healthy people in, and continually lobby the Council for Medical Schemes intensively. And we are working with the Board of Healthcare Funders as the industry body in terms of putting more pressure on Council, even through litigation, in terms of forcing them to give reasons why they're not actually approving these low-cost benefit options. We also have to find ways to reduce the cost of care, and that's where networks come in. So many schemes, what they're doing is they are contracting networks of providers, where you are contracting them at a particular rate. What it means is slightly less choice for the consumer, but if you go see a network doctor, you will pay less than, for example, if you just go see a doctor who's not in a network. Same thing with the hospital. If you require an operation, you need to be admitted. Most medical schemes at the moment have networks of hospitals. If you go to a hospital network, there's no co-payment. If you don't go to a network hospital, there will be a co-payment which could be as high as 20 or 30%. So,
Kevin, do you work with other players? And you spoke about the council, but is there a body that you guys work together, the different medical aids, or are you all independently looking at solutions?
I'd say to some degree we are working independently. I mean, we have to obviously be careful around competition and the Competition Act in terms of how we collaborate. But there are some initiatives like electronic health records where we are working together as an industry body to look at putting things together. Bryan, I think the second thing you raised was the issue of national health insurance. Yeah. National health insurance is again one of the things that's a massive uncertainty for us in our industry. There's almost no detail around what it's going to actually cost, how it's going to be funded, and what the rollout actually entails. But what we do know is that if it is rolled out as intended, as a fully fledged national health insurance, where the whole population in theory would get effectively free cover, what we do know is there's very little scope for private medical schemes into the future.
But Kevin, isn't that really the bill that could be passed any day?
Yeah, the bill has
You
been
guys
passed.
there's been so much opposition from all the players in the industry, and the parties and the bill just seems to be going on, having a life of its own.
Yes, it's currently sitting with the Council of Provinces, and then it needs to go to the President, and maybe it'll come back with revisions. But I foresee a massive amount of legal challenges against NHI. And I think, Bryan, if you look at countries around the world, even countries that are designated as first world countries, if you look at the UK, which has had the National Health Service for however long, there's still many, many problems in terms of how it operates and the time it took to roll out, you know. And so I'm still of the opinion that there is a role for private medical schemes that can work in conjunction or next to an NHI. I have a view that the NHI should focus more on primary and preventative care and allow medical schemes to continue offering specialist and hospital care, because we have some of the best healthcare in the world in the private sector.
Kevin, can I just stop you there, because I've got to take some emails, otherwise I will lose my head. We can't wake up tomorrow and hear that the bill's been passed.
That would be a disaster.
But could that happen? Is it that far gone, or you're not sure?
Potentially it could happen that the bill is passed by the Council of Provinces, passed by the President, and then we would wait and say, what's the execution plan?
Okay.
And how's it going to be funded?
And then let's just talk about these wonder drugs.
Yeah, wonder drugs, I mean, technology is also something that's driving up the cost of healthcare in South Africa dramatically, because there's no doubt that more and more wonder drugs are coming onto the market. The problem with these wonder drugs is they're incredibly expensive. I mean, you can have drugs that can cost 300,000-400,000 Rand per ampule. And if they designate it as a PMB, the medical scheme has to provide for the cost of these drugs in full, without any limit. So it's a balancing act that we try look at when we're actually doing our pricing, because you know, on the one side, you know, how do you say to someone who's got a rare form of cancer and there's a new potential wonder drug that's come out that we just can't afford it, and if we give it to that patient, then we're actually setting a precedent and we have to give it to everybody, versus actually saying, no, we're actually not going to afford, we're not going to pay for the drug because of the affordability aspect. And it's a very, very hard decision, and we grapple with that every day when we have requests from specialists or from patients for some new drug that's come out that really is just incredibly expensive, but potentially could save a life. And those are the things that, again, push up the cost of medical aid.
Well, I'm not going to ask you to comment on the latest wonder drug, and that's this drug of dieting, which is in the USA, which apparently is going to change the healthcare. We'll talk about that another time. But let me get to some emails. Kimmy in Rudaport says, if NHI is not implemented, how is the general public going to access quality healthcare?
Well, if NHI is not implemented, the status quo continues. I mean, I have a view that government should really be focusing on improving the public healthcare sector, because there are many people who shouldn't be on private medical aid. They can't afford it. So they should be getting their care from the state, but they're concerned around the quality of care. We know that many public hospitals are in a shocking state of disrepair. So, you know, there's a lot that government still needs to do in terms of improving the quality of care and the infrastructure of the public healthcare sector, and I think that should be a priority over the NHI. But if NHI doesn't come into existence, the current status would continue, where you would have the state providing care, and you would have private medical aids where people are paying for it in terms of after-tax money.
Okay, then Leslie in Sutherland says, I would be interested in your view on what medical aid I should join. I'm a lawyer who's fit and healthy and age 26.
Again, I would say that, you know, I can't really, I'm not qualified to give an opinion, but what I would say again is that what's critical is that you actually get hold of a good broker. You know, even though you're fit and young and you're 26 and that, you know, you might actually find that you're on an option where you're overpaying for benefits that you don't need at this stage of your life, and your health healthcare profile. So again, you know, get hold of a good broker, someone who's been around for a long time. They'll do a needs analysis. They'll take you through the different options. They'll look at what best suits your needs and hopefully put you onto the right option.
And Kevin, the broker will earn, because built into the medical aid is a commission.
Correct.
So you're not paying more. If you don't use a broker, you still pay the same.
That's correct.
Oh.
That's exactly
Leslie, just
correct.
one comment. Just understand, healthcare is not just about medical aid. Firstly, you're a lawyer, so you need to think about disability, loss of income. Then you need to think of dreaded disease, what happens if there's a critical illness. Then you need to think about gap cover, and then you need to think about a healthcare plan. So it's a much bigger question. It's not just what medical aid. And by the way, you are capable of giving an opinion. You said I'm not. You've got enough. You've had years of experience. Well, unfortunately, I'm not going to be able to get to the rest of my emails. Forgive me. I will deal with it in our next program. But the cost of medical aid is high and will get higher in the years to come. The key is to understand your needs and align your medical aid cover with your budget by choosing an appropriate and affordable scheme. None of us can predict the future, and particularly when suddenly we are confronted with a serious illness. You've heard me say this ad nauseum. Get yourself a healthcare broker. Whilst they also cannot predict the future, they can, however, analyse your past healthcare trends to give you an informed view. Kevin, thank you for joining me this evening. It's important to note our program is to provide information and should not be construed as advice. Next week's program will be focusing on estate planning, and if you need to get hold of me, my details will appear on the screen. I'd like to thank you for watching, and good night.